everybody, my name is Sierra. I am the head trainer and founder of Oak Hills Dog Training. Tonight I'm working with Musubi again, one of my favorite little dogs. Moose is one of our psychiatric service dogs, and today he's going to help me show you how to do deep pressure therapy on the chest for little dogs. So I've got some treats here, and we're going to slowly phase out those treats because he actually knows what he's doing. You can see he's really excited about them. So to start off, I'm going to place my service dog in a sit between my legs. Sit. Stay. Good. I'm going to lean on back like this. And I said stay. Good. And I'm going to invite him up with the step up, lay down command. Step up, lay down. Good. And then those treats are going to go away from his nose when he has done what I wanted so he doesn't get super distracted. Stay. Good. Now, as I mentioned in a previous video, the hardest part of deep pressure therapy is not getting your dog to stay there for a long period of time, but getting them in and out of the correct position smoothly. So when he's up here, he is increasing my emotional regulation, he's decreasing anxiety. If I struggled with depression, he might help with those symptoms as well, and he's generally making me feel grounded. He is tightening his core. All right, what you looking for? Head down. Come here, head down. Good. When he drops his head, that's also increasing the weight. You'll notice I have him kind of over my stomach. A lot of people will also prefer the dog up on their chest. It just depends on your own preferences. I'm going to give him his release command. Moose, take a break. Okay, take a break. Good. Then I'll bring him back around. Come. Sit. So remember, he's not allowed to come up until I invite him. We do not allow demanding behavior in our service dogs. Moose, step up, down. Good. This time I have him a little higher so you can see what this looks like. Most people I know with little dogs like Moose like them on their chest. Me, as someone who struggles with asthma, if I had a service dog Moose's size, I would prefer him a little lower, but this is fine for practice. Hi, good boy. Now you can see Moose really is an expert at this point. He got his treat, but now he's drinking in that physical affection, which is primarily how we reward our service dogs once they know what they're doing with this task. Take a break. Good. Now, Moose is a total expert. So once your dog is comfortable coming up from between your legs, the goal is for them to come up from your hip. When they come up from your hip, they have to be able to kind of turn their own body around and not need so much direction. Let's see if Moose can show you guys on camera what this looks like. Come. Sit. Good. Step up. Sit up. Good. So a little sloppy because he was distracted by the treat, but he got there. You can see he kind of slithered his body around. Stay. Stay. If a service dog is sniffing, that's a no-no, right? That means they're distracted and not being focused on their work and their handler. This is also why I phase out treats really quickly in my program, because I want dogs to be dependent on physical affection, not treats as soon as possible. Take a break. Good. Moose, come. Sit. Yes. Step up. Step up. Come on. Up, 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 up. Good. Yes. And you'll want to encourage your service dog with a happy high voice until they get to the spot where they are meant to be, and then you say good or yes as your positive marker. That lets them know that's what I want. In contrast to an which is a negative marker, that lets them know that's not what I want. Take a break. Good. And that, my friends, is deep pressure therapy on the chest. With differently sized dogs, I will also show you how to do deep pressure therapy on the lap while sitting in a chair. And you may have already seen our video on deep pressure therapy on the lap with little dogs. Stay tuned for more videos on how to train your service dog at home.